So for us in the rural communities, this is absolutely critical. It always has been a critical issue, and today, with the decline of healthcare services in rural areas, it is becoming even more so.
Yes, I'm Jim Moos. I'm pastor of the Bismarck United Church of Christ, and I'd like to address this somewhat from the faith perspective. Karl mentioned that we're at the top of the scale in the country for adults in a family that are working. We're also, North Dakota's at the top of the most church state in the nation. And this is a faith issue. It's a moral issue, among other things. If one reads the Gospels, I don't think there's anything Jesus spent more time doing than healing the sick. And his efforts were directed towards the underprivileged, towards the disenfranchised. That is the model that we have. This is a faith issue. It's a moral issue. We all love our country. America is a great country. How do we measure that greatness? In terms of our economic wealth, our political power, our military might. Jesus suggests that we measure our greatness in terms of how we care for the least of these, his children. And if we can bring affordable, quality, accessible health care to the least of God's children, then we truly will be doing something great. This is, as Wade mentioned earlier, a justice issue, and justice was critically important for Jesus and for the Old Testament prophets. And as Americans, we think that justice is important for us too. We talk about liberty and justice for all. Those words were written a long time ago, and yet they continue to have new meaning in every generation. And I think that justice in healthcare is the calling of our day, and one of the ways that we can fulfill the promise of Jefferson and our founders.
In conclusion, I think I'd like to say, if you look through God's Word, you come upon stories, and you come upon the story of the Good Samaritan. One who was ill is healed, not because he had the means or the wealth to do it, but because a stranger reached out and took care of it, and took care of whatever needs were there. The question it was answering is, who is our neighbor? And our neighbor is the person who cares for us. And if we understand any one thing in a rural community such as North Dakota, we understand what it means to be a neighbor. It's somebody who cares for somebody else. And there is no more critical area where we can act out that quality of our own community than in healthcare, and in providing it and making sure it is there for everyone. Thank you.
Can I ask you, what do you think is the most egregious, you call it misinformation, the misinformation that's out there? What do you think is the most, one that causes you to stand up saying, no, that's not right?
We probably all have different ones here, so you might get different answers. But there's been so much misinformation. It's almost hard to pick out the one. It's like eating at a buffet. But the bottom line is all the things that healthcare would do to take away Medicare, to reduce Medicare, what healthcare would do, the whole questions of end of life conversations, which was something that was highly supported by everyone several years ago, and all of a sudden became a hot issue when it was brought up. This monstrous concern about the government coming in and all of a sudden just kind of overwhelming life and taking it over as if somehow the government is the enemy. And I keep wondering when I hear that, what on earth do we have? I mean, if that's the government we have, what we need is revolt, not healthcare. But if the government is not the enemy, then why are we so worried about whether or not the government has something to do with our healthcare? I mean, we take education through the government. Those of us who are in the military, I've got a son who's in the military. His health care is very government run. It's very good, by the way, but it's government run. Medicare, Medicaid is, very government run. In spite of the person who didn't want the government touching his Medicare because he didn't want the government involvement there. It's a government process. So I mean, government is a partner in the fullness of life, and to assume that somehow it is the evil enemy, I think is the basis of one of my most egregious concerns.
I think for me, one of the most egregious errors is that we somehow can't afford to have a just healthcare system. My counter-argument would be that we can't afford not to have a just system. Karl's already talked about the difficulty of rural America and rural families, most of whom are self-employed, and not being able to afford health care as it goes up year after year by multiples of the cost of living. Also, for-profit businesses and non-profit churches and other entities are simply being priced out of the market. I don't believe we can afford not to do something.
You know, everyone compares our system with other countries, and they'll say, well, I know someone in Canada, or I know someone in Germany, and they base their whole system on that one person's experience. And you could ask 5 people around the table from America their healthcare experience, and you get 5 different answers on how we feel about our own. So we build all these big arguments based on one person's little perspective, and we have to shut down the idea we can't be like Canada and or someone else. But yeah, you touched upon the other thing too I keep hearing is, don't touch my medical system, which is already government run. So how dare we try to take on a government system?
I'm always amazed at our rural communities, the number of benefits that we have for families. And the vast majority of those bake sales and spaghetti suppers are designed to help people who cannot afford or don't have the insurance. Or didn't have adequate insurance. And even those who do have insurance have enormous bills when they face a health crisis. We simply cannot operate on the basis of bake sales for a national health care system. We have to move beyond that so that we are providing health care as a fundamental so that we know that people are taken care of. And I want to come back on the cost. Every study that has been done in relationship to having a universal system of health care has indicated that we can provide all the health care this society needs at a lower cost than we're spending today. We had the Robert Woods Johnson Foundation did a study about 20 years ago for the state of North Dakota when we were looking at a particular possibility. And that study indicated we could have health care for everybody at a lesser cost than we were spending that day. But because we have varieties of systems, they weren't prepared to go to a statewide health care program. I don't think it's a matter of cost. I don't think it's the escalation of cost is necessary. We just have to do it much more effectively and efficiently.
Just to go back on a statement that you made, Karl, about politics is the art of the possible, but you've got to look beyond possible. Here's the $64,000 question. How do you do that?
Well, I think they're beginning to do that. I think the announcement by Senator Reid yesterday that there will be a public auction is an indication that people are beginning to move to what they want for the system. Not what they think is possible for the system, but what do we want to achieve in this reform? And where do we want to lead that reform towards? And once you again have the vision, then you begin following that vision. And it takes courage to do that. It takes courage, and it also takes the faith community in particular to be in a leadership position to say, you need to go beyond today to look at the vision of what we should be and what we can be.
Those are the questions I had.
Good. Thank you.